The next session now, we're moving to look at, I suppose, the European context in terms of care and how Ireland fits in that. So first off, we're going to start with Marianna Baggio. She's a research officer in the Social Policies Unit at Eurofound. She works on aspects of the European Quality of Life Survey, as well as on the topics of gender pay transparency and informal care. Marianna holds a PhD in Economics and Management from the University of Trento, specialising in behavioural economics. And her paper this morning is entitled Out of the Shadows, Tackling Undeclared Care Work in the EU. So, Marianna, I'll invite you to...
Thank you very much. You are a lovely audience. I really liked all your questions, and it's nice to speak to such an engaged audience that has an interest in what we are talking today. So I'm looking forward also to your questions, because those were questions that really sparkled some thinking into my brain as a researcher, and I hope you keep them coming and challenge also what I'm going to present today. I'm going to start with a question, and I want you to think about when you have to take care of somebody or when you needed care yourself, and your mother, your father, your brother, your family, your friends, they couldn't help you, and what did you do? Maybe you had to look after your children, they were sick and you had to go to work, and maybe you found a babysitter. Maybe you're working full-time, long hours, but you still need to clean the house and do the washing, and maybe you hired somebody to do that for you. Maybe you had an hospitalization and you come home and you need still some care. Maybe you need some injections done, and nobody in your family is able to do that, but in the village there is a nurse, and you paid her a little bit to come home and take care of your injections or dressing your wounds, whatever the case may be. And I want you to think about when you hire these people, if you hired them with a contract or it was cash in hand, and maybe that was the only option you had. And I want you to think about these people and whether maybe one day they were sick and they couldn't come, if you still paid them. Or maybe you went on holiday and you didn't need anymore the cleaner to come to your house for those 2 weeks that you're away, if you still paid her. And this is about undeclared care work. And it's about something that we might all need at a stage in our lives to engage with, unfortunately. Maybe because we don't have another option. Maybe because we don't know how to deal with properly engaging with somebody who's helping us. And I think this is something that we might not really think, in such a context of the care world, but it's a really important part. In Ireland, 1 out of 3 people that are engaged in family activities, that work in a family, are unfortunately undeclared. It's more or less in line with what we see in Europe. And I want you to think about undeclared care work within the care economy. And I like to make a little drawings and make it easier for us to understand where these things sit, because it's very important to define. And we had in the previous presentations some discussions around how do we define care, what is it not. And for us it was really important to put undeclared care work in the perspective of the care economy, because we know we have paid care and we have unpaid care. Both very important, but we also have regulated and unregulated care. Regulated, it's your nurse, it's your teachers. In some member states, it's regulated, in some others not as much, and then it's unregulated care. And undeclared care work falls in that paid, can be regulated and unregulated. It can be the nurse that comes to your home and helps you out after an hospitalization, but it also can be a cleaner coming to your home and being paid cash in hand. And it's quite a big portion, and it's very important that we look at that as well, beyond unpaid and paid carers, which are part of this care economy. The undeclared care work is also a part as well. And I think, talking about definitions, when we wrote this paper and the research report that is connected to it, we had lengthy discussions about what do we include in care work. Is it just direct care, so your personal assistance and immediate support for children, older people, people with disabilities, or those with health conditions because they can't take care of themselves? Or is it also indirect care, looking about, cleaning, cooking, and household maintenance. And we went for the latter. We wanted to expand this definition because I'm sure that if you're a mother or a father and you don't wash the clothes for your kids, and your kids are going to go to school with dirty clothes or not fed properly, that's not proper care for your child. So it is important as well that we look at that extended form of care, because especially if we work full-time, we might need to outsource some of that care if we can't manage to balance it all in ourselves. So we try to expand the definition and expand the definition also to look at undeclared care work, because if we don't, we are missing an important part of how we look at care today. And undeclared care work comes with many, many policy challenges. First of all, it's about defining and measuring undeclared care work. How do we know how many undeclared care workers are there? This is a challenge because we might look at too narrow definitions, too broad. We can't really collect the data, but we need to be able to quantify the phenomenon. Otherwise, policymakers won't be able to say this is something really important or something marginal in our bigger picture. So this is one challenge. So all the estimates that we have are estimates of something that is submerged, it's in the shadows, that people won't really declare for obvious reasons. And then we have the general challenges of undeclared work, doesn't matter the sector. It's about distorting market competition, it's about poor working conditions for those who are undeclared. It's a lack of social protection, it's about tax evasion, but it's also about poor standards in the work that is being quite often delivered. And then there are specific challenges to the care work, such undervaluing it. And we've seen in all the discussions earlier as well, care is undervalued for a number of reasons, and we can see it also in the low wages of people paid for care work and poor working conditions. This is very important. This is totally unfair and very, very risky. There is an uneven gender distribution. Majority females who do undeclared care work, like they do declared and unpaid care work. It's also reflected here, nothing different. There are very serious psychological risks of taking care of somebody in an undeclared environment, because you don't have any protections. You don't have recourse if you're not treated well. What you're going to do? Who's going to protect you? Nobody knows that you're working. And also there is insufficient training for caring people, because you're undeclared. How do you have access to training? Who's going to see that you need training? And how is this person left alone in the caring activities? I think this is completely unfair for both the carer and the person who's cared for. So there are many, many challenges, and it's not an easy issue to task. But when we did our analysis and our research, we found that in many member states, they've tried to be creative, and there are solutions out there. It's not totally a ugly picture where nothing can be done and everything is wrong, but there is also a lot of movement and a lot of things that can be done. And I think I would like to bring that message today to you as well, because there is things that we can learn from each other at EU level, and we try to map that as well. So when we look at undeclared care work, it's quite a big chunk of people in the EU doing this kind of work, 6.8 million. National data and estimates point towards close to half of care workers being undeclared. You can see here some statistics from the Mediterranean countries: Spain, 32, 36, Italy, 47, Portugal, 48. In Ireland, I think it's 1 out of 3. So still relevant for you as well. Mainly women, as we've said. Cyprus has an estimate of 95% women doing this job, 98% in Spain, 89% in Italy. So all the undeclared care workers basically are women in these countries. Middle-aged women, quite often from a migrant background, and the origin varies by country. You can see third national countries very specific for each EU member state. They can also be more or less educated. Some people has a degree maybe in nursing in their original country, so it can be that it's not recognized, and that's their only option to find some employment. But we also see a lot of friends, family members that become undeclared care workers. So they are paid to do their job, and they are also have a connection to the ones that they care for. the main drivers of undeclared care work, there are many. One, very important, is the lack of accessible and affordable formal care services. If you can't afford what the market is giving you, it's too expensive, you can't access, there is no space, what other options do you have? And sometimes this is the last resort. There are also cost savings for the households, but also more disposable income for workers sometimes. And this is also linked to a failure to recognize the true value of care. Sometimes if you're paid very little and you have to regularize your position, you might decide not to do it because then what you have as disposable income is, very little and not as much as, it should be valued. And I think you can see here in the graph on the right-hand side that there was a little bit of a cost comparison for care work hourly rates. In red, you see undeclared care work. That's the average for some member states where they were able to do this kind of assessment. It's €7.70, and the economy at large, so all the jobs, is 25.35. And even if it's declared, then it rises up. If it's provided via service providers, it's even more. But you can see the stark difference there. It's very undervalued and underpaid. There is a very weak legal framework regulating the provision of care and domestic services. A lot of administrative burden for employers and workers. So if you try to hire somebody to be a regular babysitter in your household and you have to navigate the administrative issues around it, sometimes they are just too overwhelming and you just give up. There is also a lack of integration of migrant workers, which we've seen are quite a big chunk of these undeclared care workers across the EU. But there are also social norms and the acceptance of undeclared care work. And this is linked to the undervaluation of care. Sometimes you think that, women care for us anyways, we just give them a little payment under the table and who cares, that's what they're meant for. And I think that's kind of social norms. It's quite strong and it's highly related to the type of work being undervalued and not recognized for what it really is. And, Suzanne said it makes our societies move forward. It allows us to work. It allows us to be productive. And if we don't see that, if we don't recognize that, that's another outcome for the care economy, to have undeclared care workers, that they are not recognized, that they are not protected as well. And then we also had a little bit of thinking around the enabling role of social media and online platforms from undeclared care work. Sometimes if you need help in the house, you might find it online, and you might find it maybe at the beginning in a platform and it becomes undeclared. But this is also something that we can leverage to bring out of the shadows this kind of work. The nature of undeclared care work, I think it's also very important to understand that there is a wide range of tasks, and sometimes if you have a living carer, they also are asked to do other tasks, like do the washing, do the cleaning, go to my mother as well and do the cleaning there. So there is no protection in terms of the wide range of tasks that they are asked. The job quality is poor, physical risks, physical demands, also exposure to adverse social behavior, not to forget. If you don't value this work, you are also at the risk of being shouted at, denigrated, treated poorly. High work intensity, you might be hired as a living carer, your wage might be decent, but then you are 24/7 on the clock. You sleep in the house, you're cold in the middle of the night, you have no space for yourself, and this is really, really risky as well. And I think it's important to also highlight that domestic workers overall sometimes are undervalued, even if recognized legally. For example, in Cyprus, we've seen that the average wage for domestic workers was €460 compared to €940 as the minimum wage for other workers. And this is a telltale sign that we are not giving it the right recognition in terms of value. When you work as an undeclared care worker, there is a lack of legal protection, no labor standards or rights, no social protection, no paid leave, no pension, nothing. It's also financial and sustainable because, of course, then in the long run you won't have a pension. What is going to happen to you as an undeclared care worker? There are physical and mental health challenges. If you get sick on the work, maybe you strain your body and you feel like you can't take leave because they're not going to pay you or they're going to fire you. You're going to keep on working, and that puts a lot of pressure on you. A high risk of exploitation, and then there is also a lot of social isolation and exclusion, especially for migrant workers. Now, on the positive note, I think there are many policy solutions that we have mapped, and they can be direct or indirect measures. Deterrence, of course, needs to be there. We can't not have it with your penalties and fine and improving detection. But there is a lot that we can do to prevent undeclared care work by enabling compliance, making it easier on everybody, on employees and employers, on families and workers. We can have a lot of preventative measures, legitimizing measures, curative measures, and we'll see them now shortly. But there is a lot of work that we can do in indirect measures. We need to change the norms and beliefs. We need to address institutional imperfections. And as always, when we talk about policies to tackle these kind of issues, they need to be comprehensive. We can't just do deterrence. We need to do all four of them so that we shift everything in the right direction in an easier way. I mean, if the norms and beliefs are not there, we can do a lot, and our policies are going to struggle much more. They're not going to be as effective. So when we did our mapping, I think deterrence was something that we didn't look very much into in terms of penalties and fines, but we did look at improving detection, and I think there are new ways to uncover undeclared care work. And Ireland has an example where they said, it's difficult to go in the households and check how the workers are being treated, if they're regularized or not. So Ireland, for example, said, we can have the labor inspection done in a third place. We can meet somewhere else. And I think that's a good solution to start and working towards improving detection and do inspections outside the household. It's one of the solutions, and it's a good one, I believe. Simplification, this is really important because a family is not a standard employer. They don't have the resources, the time, the knowledge to hire somebody formally as a standard company or an organization. So we need to make it easier by reducing the complexity of the bureaucratic burden, and we need to encourage formal declaration of any care workers. There is a lot of work that can be done in legitimizing the tax incentives, definitely something that can be worked on. But a lot can be done also in terms of care allowances, making sure that they are designed in a way where it's incentivized for the undeclared care workers to become really declared, because some funds can be given and these can be used to take out of the shadows these workers. Vouchers are also a very nice solution. They are in Belgium, France, Italy, Austria has used them. And what they are, it's basically a way to pay your care workers in the family in an easier way that is also subsidized. So the government pays some of the social benefits. So it requires a little bit of help and funding from the government, but it's an easy solutions because the families just buy a bunch of vouchers and they pay one voucher per hour, and it's an easy way to just make that formalized. And then there are many other measures, but I think really making it easier, it's a good option. Some member states have these bank accounts for carers. You just pay the carer directly in the bank account. The government keeps a little portion for the social benefits, and that's it, as much as the bureaucracy that goes with it, but it's something, and it becomes easier for everybody to make it legal. A lot of times direct measures are also amnesties and voluntary disclosures. There are two examples in Italy and Greece that are very, very, very interesting. During the pandemic in Italy, a lot of workers that are living carers were illegal migrants. So they said, we still need them during the crisis, and they did an amnesty. However, we know that these living carers in Italy are mainly females of a certain age coming from certain countries. And when they they did this amnesty, the requests for regularization were coming from men, younger, and from totally different countries. And the risk here is that some of these measures are leveraged the wrong way by some people to regularize completely different forms of work. So I think it's important that we know what kind of undeclared care work we have in the country so that we can monitor also how our measures are working and if they're working effectively. Awareness raising campaigns and information, it's always very, very important to generate the behavior change that we need. It's a little bit challenging to evaluate the effectiveness of these measures, but they still need to be done in conjunction with all the other measures that we have. So I think if we had to summarize the policy pointers to help undeclared care work become declared care work, and this work being paid, what it deserves to be paid, for these people to be recognized and protected as well, I think there is a lot that can be done. And I think the United Nations 5R approach to recognize, reduce, and redistribute unpaid care work goes hand in hand with rewarding and representing paid work. And for us, it's about defining and regulating care work, simplifying administrative compliance, ensuring that we have access to what are our duties as employers of these carers, but also that they have access to their rights. Try to implement effective labor inspections, and this is very hard because the work is in the household, is not a company, is not a public space, so this is challenging, but it can be done, as Ireland showed. We need to regulate digital platform and any intermediaries because they cannot be a facilitator of undeclared care work, but they have to be something that we can leverage to make this work declared, visible, regulated. And then we have a lot to do about worker integration. We have to address the gender inequalities across the care economy so that everywhere we have a more gender balanced presence. We have to streamline migrant documentation, recognize foreign qualifications, provide migrant support services. And one of the things that we've also looked into was these proposals for having your work done as a carer in a household, may it be paid or unpaid, to be recognized as a formal set of skills so that you can go into the formal care workforce, which has a lot of shortages at the moment. So try to shift also this experience into the formal labor market. It's really, really important. But we need also to improve the quality of these kind of jobs. Declare or undeclare, it doesn't matter. We need to address health impacts, make sure that the pay is fair and that we value care so that we prevent exploitation, we support the skill development, and we really try to manage the work intensity of caring, which is quite high. I think also from an implementation strategy, I think it's important to coordinate among stakeholders because the care economy is so intertwined that we cannot think about unpaid carers without thinking about undeclared care workers or formal carers. They are all together because when we need to look after somebody, there is a good chance that we're going to use all three of these forms of care. There might be somebody who comes in the household that you pay with your care allowance. It's your time that you use, but maybe sometimes you might also need to integrate with some undeclared care work, unfortunately, because you don't have other options. So we need to talk to each other, and we need to use all of these strategies to make sure that we shift it and to make sure that we also strengthen cross-border cooperation because there is a lot of movement of these care workers, and this is also very, very important. So in a nutshell, I think we should not underestimate undeclared care work, and we should be making an effort to try and find policy solutions that they are there. We just need to be a little bit creative, and I should say also daring in trying to find these solutions. So, thank you very much.